Well, welcome to the webcast. In case we haven't met, my name is Matt Freije. Thank you for joining us. Today, we are going to talk about inspecting water management programs. We'll talk about objectives of a water management program so we have a kind of a basis to start from, um, and how water management plans reduce pathogen risk, the keys for them accomplishing that. Most of the time we'll spend on water management program inspections and how to do those well. Near the end, I'll demonstrate three new functions, features we have in LAMP so that you can see that. So the objectives of a water management plan will depend on who you are, what your role is. For facilities managers, property managers, infection preventionists, which are most of you on this call, you want to reduce health risk, right? You want to promote wellness in your facilities. You also want to conserve water and energy, lengthen the life of your assets for facility resilience. And if you are subject to certain standards by the organizations that accredit you, or by your state, then you also want to stay in compliance with those requirements. Health departments, you want to reduce the risk of disease as well. And if you have regulations for water management programs in your state, you want to ensure compliance and you want to be able to do that effectively. You also want to be able to do it sustainably. If you are an insurer, then you want to reduce health risk too, so you can reduce exposure to claims. So for really all of us, I think what we have in common is we do want to reduce pathogen risk. We agree that that is at least a big part of water management programs for building water systems. In 2021, we did a study of 900 and some water management plans and LAMPs, and we started out with the assumption, well, if you have a water management plan in LAMPs, it is a comprehensive plan. I mean, you can deactivate control measures. There are things you can remove from the plan, but at least when you get it, all the default content, it is very comprehensive. So we wanted to find out to what extent were facilities implementing the plan. And we looked at that, but what we found that we weren't really looking for when we started the study was a really very, very clear relationship between implementation of a plan and Legionella positivity. We saw it was almost linear. The data was so clear. Legionella positivity decreased with increasing control measure compliance, meaning the verification was on schedule. The control measures were on schedule and had okay status, and testing, Legionella testing, but it wasn't just that. It was temperature testing, disinfectant testing. The more testing there was and the higher the percentage of control measures with okay status, the lower Legionella positivity was. However, few facilities were fully implementing the control measures in the testing. So the CDC did a study as well looking at data for 14 outbreaks that occurred from 2015 to 2019. And they found something similar, that implementation of a water management plan was really significant. And so they emphasized in that paper the difference between a water management plan document and a water management program process. And so even facilities they found had what they called comprehensive water management plans, they still found deficiencies. And 70% of the deficiencies were in the implementation of the plan. They concluded all of the deficiencies associated with outbreaks could have been prevented by comprehensive, properly implemented water management programs, which is quite a strong statement. So process is important. Water management programs are not a document. They are a process. And the ASHRAE Standard 188 and Standard 514 framework aligns very closely with ISO in terms of being a quality management system with plan, do, check, and act. So you establish a plan for ASHRAE 188, then you have to do the plan, you have to implement the plan and even verify implementation of control measures. Verification is an important part of Standard 188. And then you need to check, you need to monitor each control measure to make sure it's being performed within the control limit. And you need to perform validation procedures to show that the overall program is accomplishing its objective, which in the case of ASHRAE 188 is to control Legionella. And then you have to act. You need to take corrective actions if the control measure monitoring or the validation is not within the control limits. So it's a process of continuous continual improvement, right? You implement the plan, you do testing, you take corrective actions when the test results are not acceptable, and then you are continually improving. So to be fully implemented, ongoing then is crucial for reducing risk. And to be fully implemented ongoing, water management programs must first of all be easy. When I say easy, I don't mean omitting important control measures. It's not omitting important preventive measures. I mean easy with respect to the management of the program itself, that keeping track of everything and managing the control measures and documenting everything and reporting compliance and so forth. All of that needs to be easy so you can sustainably ongoing week after week, year after year, implement the plan well. And so after we did that 2021 study, and we not that we weren't aiming to make lamps easy before, but it was much more on our agenda to try to make lamps as easy as we could for this reason, to make water management programs easier. So everything on this list, all of these lines under the word easy, we have done with the exception of the first and the last since 2021. So the first line says comprehensive control measures specific to the building type and specific to the water system types. We've had that since LAMPS was launched 10 years ago in 2016. We've also had built-in training, the last item on the list since we launched. We have a lot more training than what we did initially, but we had training back then that was built in. But everything in the middle we've added since 2021. All the automation of targets and limits, notifications and alerts, automation of control measure documentation with reports and summary reports and so forth, location saving and integrations with sensors and with laboratories. And then the most recent, the steps we've taken to make water quality data entry so much faster. So water management programs must be easy. They also have to be required. I mean, we all know this now, right? When ASHRAE 188 first came out in 2015, most of us thought, wow, we have a consensus document now. Facilities are going to embrace this and set up and implement water management programs, but it did not happen. It increased, but still a very small percentage even today are implementing water management programs if they don't have to. So many of you are on this call are with hospitals. You pretty much have to, right? Because of the CMS mandate, because the Joint Commission or ACHC or DNV, whoever accredits you, they require it. But others of you on this call don't have to. You're with data centers or hotels or commercial buildings, and you don't have to do that. So kudos for you for doing it voluntarily, but you are in the minority. Most facilities, the really valuable brands, the companies that are doing everything else well, they are doing water management programs, but the vast majority are not. So the programs need to be easy. They need to be required. And that's why so many states now are looking at establishing regulations. New York, for healthcare facilities anyway, has had them since 2016, and now New Jersey's regulations go into effect in September this year. A few other states have regulations to some extent, and others are looking at it. So they need to be easy, they need to be required. They also need to be inspected, because even if they're required, if they're not inspected, there will be pretty low compliance. So that's what we're going to talk about now. We want to focus on the main topic, and that is, how do you do these inspections? How do you do them well? It's so important with whether these new and pending state regulations will ultimately reduce pathogen risk may depend largely on how well the health departments or whoever's in charge of inspect the water management programs. It's really that important. So if the CDC shows that water management programs to reduce risk must be an implemented process, and if the ASHRAE 188 framework is a type of ISO 9001 process, then it would make sense for inspectors to focus on inspecting processes rather than documents, right? To focus on the big rocks. So let's kind of go back to the foundation, the top third of this diamond. It lists factors that you probably are all familiar with, factors that are listed in ASHRAE Guideline 12 and Standard 14 that affect microbial growth: temperature, disinfectant residual, water age, system cleanliness, cross connections, plumbing materials, surface area. Surface area is one that's been talked about more in recent years, hugely important because that's where biofilm develops, right? Water supply is another important factor, but since that's not specific to the building, it's outside the building, that's not listed here. So those are the factors that really affect pathogen growth. And pathogen growth is the main factor that a building can control. I mean, they want to control transmission. They're not very much going to be able to control the susceptibility of the host, right? Of the people who are exposed. So you want to focus on pathogen growth. And then, so the activities then that affect those factors are the design of the system, how it's operated and maintained, monitoring of conditions, monitoring of certain parameters, and then taking corrective actions when the monitoring shows results that is not acceptable. And then if you look at where do you really focus in? Where should you really focus in? It's really the operation and maintenance, monitoring, and to some extent corrective actions. Design is hugely important. I mean, it's extremely important, but it's in most cases what an existing operating building just has to live with. You can make minor design changes, but it's too expensive to just replace the entire plumbing system because it wasn't designed well. So you need to work with what you have, right? So if you're inspecting a water management program, you're going to want to inspect the control measures for operating and maintaining the system and the test results. And really, the test results would tell the story for corrective actions for the most part. I mean, corrective actions are hugely important, but if you're doing them well, then after the corrective actions, you'll retest to make sure that the chlorine, the temperature, whatever you're checking is then within your limits. And so really the test results ultimately tell the story of that. So what are some of the keys to success then for health departments to inspect water management plans effectively, but to do it efficiently so that it's sustainable? Well, one is to focus on these big rocks, focus on temperature, disinfectant, flow, system cleanliness, and as much as you can, conduct inspections remotely, right? For obvious reasons. The cost is much less, it's much more efficient. And there are some things you definitely gain going on site, but not a lot. If you have a good data gathering system and a good analytics, you can do a tremendous amount remotely and it's so much more efficient. So you can inspect facilities much more frequently than you could if you were doing it on site. Minimize subjectivity so that it's fair across the facilities. We've all heard of, some facilities getting cited for things other facilities don't because inspectors, surveyors, they're not consistent. So minimize the subjectivity. Inspect only what requires minimal knowledge, experience, and time. Now, not to insult inspectors, not to say they're not intelligent, but there's only so much you can teach somebody, right, before they go out and inspect these. And some of the things you would see on site, it takes literally years of experience. So minimize that. That also will make your program more sustainable, less costly because it will reduce what you have to do in the way of training. And like we've been talking, do not inspect what does not directly affect risk. And we're going to talk more about that too. So this is kind of a busy slide. Let's just take it line by line. There's a lot here, but I wanted to try to get this checklist on one page in one slide. So this is a suggested checklist for routine inspections. Just want to clarify that. Not for investigating cases of disease, but for routine inspections of water management programs. And let's say it's by a health department. If you have a plan in LAMPS, you're going to take a much deeper dive than this because it's all automated and you can see our reports and different metrics and so forth. But for somebody that's just inspecting a water management program, let's say from a health department, you want to focus on what's highlighted in green, what will actually affect the water, what will really affect disinfectants, temperatures, flow, and so forth, cleanliness. But if you have regulations in your state or in your city, and you're required then by law to make sure that the plan has what's required by law, and since most plans are based on ASHRAE 188, or I should say most regulations, perhaps all of them, ASHRAE 188 is the basis, so you need to make sure the plan has those basic elements, right? So yeah, look at the team list. Is there a team list? Is each person on the team named? Is there a name of the person? And do they have the email and phone? Because then they have to communicate. So you want to make sure there's a name and an email on the phone for each team member. A list of the water systems. Just make sure they're listed and named and numbered. The flow diagrams. We're going to talk more about flow diagrams. But basically, does the water management plan have one? At this point, that's all we're talking about. Does it have a flow diagram? Not anything about it, but just does it have a flow diagram? And then is there a risk hazard analysis? And this takes more expertise in terms of what should be in there, what is the reasoning behind whether it is a significant risk, whether it is the system is deemed a significant risk, and whether it is a control point. Just make sure that potable water systems, cooling towers, decorative fountains, and whirlpool spas are control points. In the risk hazard analysis, those should be listed as control points because they are inherently conducive to growth of Legionella and other pathogens. So even if the cooling tower is in great condition, even if the facility seems well maintained, it doesn't matter. It still has to be maintained. It does matter, but it still has to be maintained and operated to manage Legionella risk. So those should be listed as control points. And then the more important things to check are the control measures. And that's not easy because that takes some knowledge, but you could at least just check how many control measures are in the plan for each system type. How many control measures for potable water systems for cooling towers? And that may seem just so non-specific that it's not helpful, but it is somewhat helpful because what a lot of facilities do is they might think they have a plan, but what they really have is a policy document. So they'll say, well, one of our control measures is to minimize stagnation. Another is to manage temperatures for Legionella control or to keep systems clean. Those are policies. Those are objectives. Those are not control measures. A control measure needs to be so specific that somebody can pick up a wrench and go do it. And so to make control measures really specific, you're going to end up needing a few of them. Right? You can't just do a broad brush. So just look at how many there are per system. And then does each control measure have monitoring limits and corrective actions as required by ASHRAE 188 and which is very important from the process standpoint? Do they at least list the type of documentation for each control measure? So let's say the control measure is to clean cooling towers twice a year. The documentation for that might be a vendor's report, assuming that they're going to have an outside company come in and do that. If the control measure is to clean cooling towers monthly, let's say, then the facility might have in-house personnel do that. So the documentation might be their CMMS application, their work order software, or it could be a log of some kind. But one way or another, they should at least list the type of documentation they have to show they've done that control measure. And the plan has to have validation procedures. So are they listed in the plan? What are the validation procedures? If in your state Legionella tests are required, then do they have the required number of Legionella tests performed? And then water quality data is hugely important. It's mentioned in ASHRAE 188. It's emphasized by the CDC. It's emphasized by the VA and a number of other organizations now, and rightfully so, because it is so important. So in LAMPS, we have control measures for a number of, at least in potable water systems, for monitoring a number of what we think are really, really key water quality parameters to check, but at least check for disinfectant and temperature, because every facility should be monitoring those. Just see what they have at points of use. They should be monitoring at water heaters and other places too, certainly at the point of entry, but at least check it at the points of use because that's where people are exposed. And that's the end point of the system. So how many readings have they taken in the last 12 months? Very objective, right? An inspector just has to look at the number. How many readings are there of disinfectant and temperature in the last 12 months? Do they list target ranges? Does the facility list target ranges? I mean, if they don't, how do they know if they're doing okay? So they should have target ranges, and they should be able to tell you what is the percentage of readings that are within their target range. In LAMPS, this is all very easy to see. So if the plan's in LAMPS, you can look at their water quality summary report, and you'll see all of this at a glance. But whatever they use, they should be able to answer those questions. And then ASHRAE also mentions contingency plans, and these are hugely important. This is where what's in a document is important, because if there's a water main break or a case of disease they have to respond to, if there's a system shutdown, they're not going to have time necessarily to find a consultant who will be able to guide them well or to read up enough about it to know what to do. They're going to have to know ahead of time exactly how to respond to that. And that's so crucial for preventing cases of disease. So make sure there's a plan for responding to disease, for system shutdowns, both planned and unplanned shutdowns. Also, corrective actions. Do they at least have the documentation that shows a list of corrective actions? No facility is perfect. I mean, their test results aren't going to be perfect. So they should have corrective actions that they've taken, and they should have those documented somewhere. And then, although ASHRAE talks a fair amount about design and construction. They don't necessarily talk about a specific checklist. The American Society of Plumbing Engineers has a pretty good document on construction. And in lamps, we have a design and construction checklist. It's just so hugely important. And this is something, I mean, facilities should definitely take advantage of. It's not burdensome. I mean, if they're building a building, all they have to do is show these items to the contractors or the designers that they're hiring to do the work and make sure they adhere to it. It'll save so many problems. It'll reduce risk and probably save system fouling and all other kinds of problems down the road. So it's a construction checklist or some kind of list of procedures for design and construction is also really important. So the ones highlighted in green, those are the ones that are really important for reducing the risk of disease. The other four rows, just make sure they have it to show that they are compliant with 188. So what not to inspect is really important as well. And this is kind of hard to do, because you want to do things well, you want to make sure, you want to see 100%, right? But it's really counterproductive. When you try to get 100%, you end up actually doing more harm than good. Anything, just let go of anything that does not directly affect risk. So here are some examples. Flow diagrams. What symbols do they use in the flow diagrams? Are the symbols what the CDC has in its diagram and in the toolkit? Do they use symbols like that to indicate points of use? The CDC's is just an example. I don't think the CDC itself would say facilities should have a diagram that looks just like the one in their toolkit. Does the diagram list sampling points? How is it formatted? What are the colors? None of this. There's never been, to my knowledge, if you know of any, type it in the question box or in the chat. Do you know of any study where a case of disease has been shown to be associated with the symbols that were on a flow diagram or how detailed the flow diagram? And what's even worse is that what a lot of inspectors are asking for these flow diagrams actually makes them work. They want so many details on it that for a large facility, it's so convoluted that the flow diagram actually doesn't serve the main purpose that it has. And so I would just let that go. Just make sure they have a flow diagram, but focus on outcomes. Let them do the diagram however they want. Same for like a team list. Cases of disease are not based on how the team list is formatted and how they describe the roles of each person. We hear about these things, facilities being inspected and saying, oh, they got cited because of how their team list didn't have such and such. It just, how the team list is formatted is not going to make somebody sick. And it's not going to keep them from getting sick. I did work for years as an expert witness in a lot of cases related to lawsuits, and never was a facility in any of the cases I served in, never was a facility found negligent for how their team list was formatted or what symbols they had in their flow diagram, because it didn't matter. The attorneys couldn't make a case for that. So don't focus on the formatting and those details. It's counterproductive, and it's important because inspecting non-consequential water management plan details it could really increase disease. It could actually increase risk when you think about it, because it will divert the inspector's time and the facility's attention from what actually does reduce risk. You can only focus on so much, right? You can only focus on so much. If you put the small rocks in the jar first, the big rocks aren't going to fit. You have to put the big rocks in first. And there's only so much time, there's only so much money that the inspectors have, there's only that the departments have, there's only so much the facility can pay attention to. And the facility is going to pay attention to what is being inspected. That's what they're going to pay attention to. So it's good for them to get them focused on what makes a real difference. And the other thing too is some of these facilities, they're trying to do a really good job, and then it just saps their motivation. They're doing all these things. They're spending this money, maybe even hired more people so they could manage their water systems better, and they get cited for how their flow diagram or their team list is formatted. It's really ridiculous. It saps their motivation. Now, I'm not saying to make inspections easy. I'm not saying to make them easy. I'm not saying to go easy on facilities, because a lot of them, they may have a plan, but they're not implementing their plan. So if they're not taking their temperature measurements or their disinfectant measurements, and they can't tell you how they're doing with those and what corrective actions they're taking, then that's what they should be cited for. Go after those things that really are important. I just want to mention before we go into the demonstration part that depending on what your role is, a lamps does have some tools that can help you with this. So if you're a facility manager, look at the performance report in lamps. It's just got 10 or 15 metrics. It's the best first step to seeing how you're doing with your plan, how much of it is implemented, where are you falling short in the implementation of the plan. It'll help you evaluate it. And then the right column after the score for each metric shows how you can improve it. So just you can look in the right column and see how can you improve on this particular metric. So to get ready for an inspection and just ongoing to keep your plan effective, look at that performance score and the details of the report. And then for an inspection, use the compliance report. It's kind of an executive summary of sorts to show to an inspector that gives an overview of a lot of the things we've talked about, like number of control measures in each category for domestic water maintenance, for cooling tower maintenance, decorative fountain maintenance, and so forth. Show that to the inspector. It'll help them out. It'll save the inspectors a lot of time. If they want to take a deeper dive into any part of the plan, then they can do that. But at least that compliance report gives them the overview. And also it has the water quality report attached to it now. So that water quality summary report shows all of your tests for all the parameters you've tested, your targets, the lowest, the highest reading, the average reading, so they can see that as well within that compliance report. If you're a portfolio manager and responsible for several properties, use the portfolio report, which I'm going to show you in a minute. And that's new in LAMPS. I think we just added that a week or two ago. And that'll show you a lot of these metrics across all your properties, how all your properties are comparing. If you're with a health department, ask the facility if they have a plan in LAMPS, ask to see the compliance report, and that will save you a lot of time. If you're an insurer, I would at least ask to see the performance score, and then preferably go ahead and look at the performance report. If you know anything at all about water management, even just have a high level view, that performance score report will be very clear because it's got explanations for each metric. You don't have to, you know what chlorine is, you know what temperatures are, and you can understand that report pretty easily.